No, I mean, at that point we sort of left the room where we'd had the scan and were kind of ushered into this side room, and that was all a bit kind of like, with no one with us, just sat there sort of, okay, what happens now? Oh my goodness, we probably weren't waiting very long in that room, but, it feels like it's forever. But fortunately, I don't know whether that would happen as of norm, but we were then taken through to, as I say, the fetal medicine department, where I had a much more detailed scan. Okay. And partly that was a good thing, partly not, because that team of people then sort of gave us probably too much information almost, in the sense that we were told what other conditions could go along with the cleft. Right. And that was pretty awful, actually, because, I mean, I'd almost have preferred, but that's me personally, because I wouldn't say I'm an ostrich, but I kind of, okay, I'm dealing with one thing here, I'm not sure I want to hear everything else. I think if we'd just sort of had that more detailed scan, we learnt the sex of the baby, which was quite nice in a way. I mean, didn't want to find out having, before that, but once we knew about the cleft, I thought, well, let's prepare for everything here in terms of that. But I'm not sure I then wanted to know all these other conditions, which, some of them were pretty dire,
From the off, when we came away from hospital, we'd given these special bottles, but also she still had a tube in her nose. And so what would happen is we would allow an hour for feeding, which is what you'd allow for any other babies as well who didn't have a cleft palate. But whatever they didn't feed in the bottle, you just give a little bit in the bottle and be squeezing in, because they don't have that suction motion. And then you'd finish off with a tube.
I was asked by a midwife about whether I was going to breastfeed. She kind of looked at me after I'd explained everything to her and shown her a squeezy bottle and explained what was going to happen over the next few months and how the muscles in the mouth were formed, and she still looked at me, and at the end of that she kind of said, "Oh, so you're not going to try and breastfeed at all?" And I just thought, I'm not sure that you've listened to a word that I've said.
No, I don't think that a lot of people understand it. Which is why when people ask, we're more than happy to explain it. Because we want people to understand. Because I know some people, like if their child has a lip, the child gets looked at and things like that.
And it was a really big shock. It was a horrible kind of thing to have happened. Also, the doctors were saying to us that there was a 1 in 10 chance that the cleft was part of a bigger genetic problem. So that was, in one way that was a worry, but in another way it was kind of, well, she's our baby and we'll kind of, whatever it is, we'll deal with it.
I just wanted to say that when you find out that your child's going to be born with a cleft lip, possibly palate, it does feel like the end of the world. Yeah. But when you go through it, and as you slowly come to terms with it, and you go through everything that comes along your way, you have the surgery and you see them recover, and you just, when you come to the end of it, you think to yourself, well, I don't know why I worried so much, because they really have looked after him, and he really is okay. And it's normal to worry, it's normal to feel like it's your fault, but everything will be okay.
The first treatment I remember sort of getting braces and everything like that for about age 7. I had quite a lot. I had, the train tracks and retainers and everything like that to sort of even up your teeth. The first operation that I remember was just having a few teeth removed when I was about, I think I must have been about 7 or 8. Okay. And then it sort of went on to, jaw ups and, most surgeries that most people with clefts will have.
It does take time to develop ways to deal with it. At first it's really hard and you just want to run away from it all, but that's not the answer. You kind of need to, I personally found people that I could talk to, whether it be people at school or family, and you just kind of need to you learn to accept that you're born with a cleft and that's not going to change, and over time you learn to think that is what makes me different, and that's actually a good thing. But until you reach that point, you need to find a good support network. You kind of talk over what you're thinking, because if you don't voice what you're thinking, nothing's going to get done.
I think that's one of the most regrettable things I did, was letting someone make me think that because I look different, I should be treated different and should allow myself to be bullied. And now I think about it, I think it was quite a silly thing to let myself think.
It's easy to say that in hindsight.
Yeah. I mean, people said it to me at the time, but I just thought, you don't know, but now I think about it, it is really true.